Hi guys, good evening. Welcome back to my channel. This is Grace Flores of Simply Gracie. And in this channel, we will talk about travel, money, beauty, and fashion. For today's video guys, I'd like to give you a video about health insurance. This is very timely because we just got out from the hospital. And for someone to have a health insurance coverage, I really appreciate the time that I decided to have one. Kasi nung kailangan talaga namin siya, nandun talaga siya. I'm going to give you tips about life insurance, what's in it for us, and how much does this cost for someone like us Filipinos to get a life insurance here in the Philippines. Alam nyo guys, personally speaking, this is very important for us. No? Sometimes, most of the people treat life or even health insurance as a luxury. Kailangan ko ba to? Malakas naman ako. Until dumating yung time na nasa hospital na sila and they realize na kailangan pala talaga nila ng life insurance or the health insurance for this topic alone. So let's begin our topic discussion for this video, and it's about health insurance. The first question that we need to answer is, what is health insurance? So I'll give you a definition, and some of these tips that I'm going to give you is I got from Grit.ph. So I was checking online, I was doing some research, and I found their website, which is a very good explanation about health insurance. So if you have time, you can check their website as well. So health insurance is a coverage type that's specifically for the coverage of medical or surgical expenses of the insured. It can either pay the hospital directly or reimburse the insured for their expenses. Health insurance is usually part of the benefit package offered by companies to their employees. So health insurance is different from life insurance. When we say life insurance, it covers life. Something happens to you, the life insurance company gives some kind of money to the family that is left behind for them to start off with. But the health insurance is to protect yourself itself. Na something happens to you, ma-hospital ka, hindi ka na may stress para kung saan mo hanapin yung pera for your hospitalization bills because your health insurance will do its part. Next question is, what is the difference between PhilHealth, HMO, and health insurance? So the Philippine Health Insurance or PhilHealth is a government-run insurance provider. Compared to a private providers, this type of insurance is more affordable. PhilHealth has an established insurance programs that provides financial assistance to Filipino citizens who are employed or otherwise and in need of medical attention or surgery. If you are an employee, half of the monthly contribution should be shouldered by your employer and the other half will be deducted from your salary. So the next question is, how much assistance can I get from the PhilHealth? So it depends on the kind of illness or medical attention that you needed. PhilHealth, HMOs, and private health insurance providers share the same goal of covering their members' medical bills and expenses. It is their approach or methods of transmitting their services that vary. Take a look at this comparison. So let's have a comparison between a PhilHealth, HMO, and health insurance. So when it comes to provider, PhilHealth provider is the government, HMO is the HMO companies, health insurance is the private insurance companies. Governing agencies for PhilHealth is DOH and the government. HMO is governed by Insurance Commission, and health insurance is governed by Health Commission. As to age coverage, for PhilHealth, no age limit. Senior citizens get free coverage. For HMO, it's only up to 65 years old. And for health insurance, it's from 16 to 75 years old. When it comes to policy term for PhilHealth, as long as the member are paying, you are covered. Seniors and PWD, they are indefinite. For HMO, annual ang renewal. For health insurance, it's usually fixed. For premium naman, constant unless change are mandated by the government. So as we noticed, diba, they PhilHealth increased their premium contributions. Sa HMO, it increases as member ages. So the more or the older we get, the higher the risk the company is insuring. Or that's why it gets increased as we age. Same with the health insurance. Transmittal of subsidy or insurance for PhilHealth, automatic deduction from hospital bill. So kung makikita nyo sa mga hospital bills natin, meron doon PhilHealth deduction, if you remember. Whereas for HMO, just present your HMO card and the bill will be charged against the consumable limit of your HMO coverage. So sa HMO, let's remember that there's a certain kind of limit, no? So pag na-hospital tayo, i-charge nila hanggang sa limit mo. Anything that is excess, you have to pay it out of your pocket. And for health insurance, usually it's reimbursements if mga small amounts. Or sometimes even big amounts, if the patient can afford it, they will do reimbursement. One hassle thing in the hospital also is during checkout or during discharge. It will take a lot of time for the health insurance company and the hospital to get into the proper documentations for you to be discharged. So if you're a patient and you are really very eager na to go home, you are ready by 7 in the morning and it's already 4 o'clock in the afternoon and they have not yet decided what is the total amount or is it covered or not, then the patient will have the decision most likely to have the expenses reimbursed. Magbabayad na lang siya out of his pocket and just file a reimbursement form from his health insurance companies. And what happens is, in case policy not used in a year or contract periods of PhilHealth, the contribution goes to the PhilHealth fund. For HMO, policy defaults after the calendar year, whether or not annual limit is consumed. And with this means that kahit hindi ka nagkasakit, wala namang mababalik sa'yo, no? It's just that an assurance that something happens to you, meron kang backup plan. For some HMO companies or some health insurance companies, it may earn dividends that are withdrawable. So there's one health insurance companies that I know that habang hindi mo nagagamit yung iyong health insurance coverages, part of your money is earning, and that is Kaiser Healthcare. So what I like about Kaiser Healthcare also is that it covers you now up to the age of our senior years, like when we retire and we don't have the health coverage or the HMO anymore from our companies. And hindi na rin tayo insurable because we are already above 75 or above 60. With this Kaiser plan, as long as you got your plan before you reach the age of 60, i-cover ka niya even beyond 60 years old. And while you are not using your healthcare plan, meron siyang investment component. So ito yung some of the good side of a private insurance company. So hindi naman din lahat ng mga private insurance company na ganun. So you have to properly choose ano yung mga benefits na makukuha mo sa mga insurance, and of course, ano yung kailangan mo. Hindi naman porke meron siyang ganung coverage pero hindi mo naman pala siya kailangan, so that it doesn't make sense for you to get it. Like for example, this time, if your family have this kind of diseases that you may actually have few years from now, or sa feeling natin, parang hindi naman ako abutin ng 60 years old. So, maybe you don't need it. You need an insurance that will cover you in the event na umatake sa'yo yung mga diseases ng family natin. Like yun nga, sabi ko, hypertension, diabetes, cancer, heart diseases. Okay? Because the contestability of those illnesses is only 1 year. So, if you stayed with your insurance company for 1 year, on the second year onwards, i-cover ka na ng yung health insurance companies. So, next question is, what are the benefits and health features of health insurance? So, sa PhilHealth natin, basically, covered tayo sa PhilHealth natin ng inpatient and outpatient, ancillary services, catastrophic coverages, maternity benefits, and surgeries. Included naman on HMO mostly are outpatient services, laboratory tests, medications, and other ancillary services. We have surgeries for that, hospitalizations, and dental services. Sa private health insurance naman, since sabi nga natin, they offer more than the usual PhilHealth and the usual HMO. So the private insurance company offers critical illness benefits. They have financial assistance for hospitalization of surgical expenses. They have ancillary services like laboratory tests and medication. They have financial assistance for loss of income in case of illness or accident. So may mga insurances na gano'n, may mga benefits na gano'n na if ever the member gets into the hospital, meron silang parang tinatawag na daily allowance. So, higher compensation depending on the medical condition. So, again, it depends on the policy na kinuha mo for yourself. And sometimes, it has a life-saving benefit. It is offered only by some providers. So, hindi siya lahat in-offer ng lahat ng insurance, health insurance company. Some providers lang. Yung sabi ko nga sa inyo, one example of that is the Kaiser Long-Term Healthcare because it offers 3 major needs in our financial life. It has healthcare, it has investment, and it has insurance. You might be thinking that what each type of health insurance offers pretty much the same, which makes choosing difficult and very confusing. No? Sabi natin, pare-parehas lang naman yung mga health insurance. Actually, if you really take a look at every policy, meron silang pagkakaiba. They do have strengths of their own and it should help you in making decisions, in choosing what insurance that's best for you. Just like what I've said earlier, I have 2 health insurance coverages. One is my Kaiser Long-Term Healthcare. So I actually prepared that because I was diagnosed with an endometriosis. So I was operated twice na. So na-surgery na ako twice. One is laparoscopy. So in-scrape nila yung cyst. And the second one in 2010 after 2 years because my first surgery was in 2008. After 2 years, tinanggal nila yung aking left ovary. And my OB said it could happen again. No, so with these kinds of symptoms and all like that, so I might have another surgery. So that's one of the reasons why I got my first health insurance, which is the Kaiser Long-Term Healthcare, because before it was just 5 years to pay and you will be covered for life. And if you don't get to use your your health insurance, it earns interest, and at the same time it has a life insurance coverage. And my second health insurance is my short-term insurance, which covers me globally. Kasi I don't wanna get or use my Kaiser health insurance kasi I am preparing that for when I get old, when no insurance company will cover me na. So right now, for my short-term health care, I have this AXA Global, and it's very good because it covers me globally. So me and my husband travels a lot, and so I need a health insurance that will cover me worldwide, anywhere in the world. No? So it's very hard to get hospitalized, especially outside of the country. Mauubusan ka talaga ng pera. So it's best to have a short-term insurance that will cover you globally. So if you want my recommendations, I highly recommend AXA Health Global because it gives you the peace of mind when you're on travel. And if you want to know more about this AXA Health Global, you can contact my friends. They were the best agents I have in this kind of healthcare, the short term, because they are really tested. Nung na-hospital kami at nung husband ko, they are very active in supporting me and in assisting me during the time that we were in the hospitals. Even on discharge and the bills and the doctors, talagang hindi mo na siya iisipin. Contact Brian for AXA Global. And if you're interested about Kaiser Long-Term Healthcare, the healthcare that covers you even beyond 60 years old or during retirement age, let's talk about that one. The next question is, what's the average cost of health insurance in the Philippines? So actually, PhilHealth, which is the most affordable of the 3, cost you 1,400 to 6,600 a year. So depende yan sa'yo. So usually, I think the 6,600 is for the OFW. So this depends on how much you earn and whether you are under formal or informal or voluntary bracket. If you are employed, half of the contribution should be covered by the company. So the cost of HMO premiums vary depending on the coverage you're getting. The plans would cost anywhere from 10,000 to 6,000 per year. So as a private health the private health insurance naman, the lowest that would cost you will be 40,000 a year to be covered. But I don't know how much is the coverage of that one, but what I have again is the AXA Global. I paid 67,000 a year, but I am covered for 100 million pesos a year. So I think that is more than enough for us, diba? So 40 to 60, a little bit difference lang. I think 40 will just cover you like 500 or 1 million per year, but with AXA Global you can get as much as 100 million for a 67,000 annual premium at my age. So I'm around 42 right now, and I'm on my 4th year with AXA. So who should get a health insurance plans? So these are my thoughts, no. Number one, if you are the breadwinner, you should get a health insurance plan. So we work so hard for the rest, hindi naman masama para alagaan din natin yung sarili natin, no? Pag nagkasakit tayo, hindi na natin yun pag-iisipan pa kung saan natin kukunin yung ating mga kaperahan para sa pang-hospital. Number two, if you're a frequent traveler, no, here and abroad, I suggest also you get your health insurance that covers you globally. So, kahit saan merong mangyari sa'yo, meron kang backup. Number three is if you have illnesses sa family, yung mga namamana, hypertension, diabetes, heart diseases, cancer, yung mga ganon, etc. Alam natin kung ano mga yon. You should get your health insurance coverage as early as possible habang hindi ka pa na-diagnose to have those kinds of diseases para naman covered ka instantly pagkakuha mo ng insurance, ng health insurance. Kasi pag na-diagnose ka na, it will belong to what we call pre-existing illnesses, and it will have a contestability period of 1 year. Meaning, something happens to you within your first year, and ang cause is hypertension, and then na-diagnose ka na nun, they were considered pre-existing, hindi nila yun i-cover. You will be covered on the next year. And, of course, number 4, if you love your family, no? So, hindi naman pag na-hospital tayo, pati yung family mag-worry. If we love our family, we should get a health insurance for ourselves. So again, just like what I've said earlier also, this is very timely, and I really wanted to do a vlog about health insurance because of what we've experienced recently. So for us to be at the hospital for 4 days, we had a bill of 800,000 almost 800,000 pesos. So for the doctors, it's 250 and almost 550 for the hospital alone. So total around 800,000. So naisip ko that time, 800,000 for a 4-day hospitalization. Kung wala kaming health insurance, saan kami kukuha nun, no? Of course, it will gonna hurt our pocket. But if you have, luckily, we have the life insurance, so we've saved. So, ang ano naman natin, just like what the doctor said, primarily, the main concern that we go to the hospital is to save the patient. No, secondary na lang yung mga babayarin. But of course, it will give us a really big peace of mind if we know na, sige doc, kaya gawin mo ang kailangan, walang problema sa expenses. Kesa yung mag-iisip ka pa, pag sinabi ng doktor, we need this, and then nagdadalawang isip ka kasi iniisip mo saan mo kukunin yung funds. For Filipino talaga, hindi na natin iniisip yung sarili natin, yung pagkuha ng health insurance for ourselves. Kasi iniisip natin, para sa family ko na lang, para sa anak ko na lang, para sa mga personal mga babayarin or present na mga babayarin na lang. And then, on the back of our mind, we know that we have to get it. But because of these things na dumadaan sa mga utak natin, nakakalimutan natin siya. And then later lang natin siya nare-remember na dapat pala kumuha ako noon nung nandun na tayo sa situation and nandun na tayo sa hospital at nagkakraming na tayo, meron na tayong nararamdaman. Health insurance doesn't work that way. Pag meron ka nang nararamdaman, hindi ka na i-cover. Okay, so it's better to get a health insurance while you are still young and healthy. That is the best time to get your life and even your health insurance. In the hospital also, I've seen like a lot of differences between having a healthcare provider and not having a healthcare provider. So with us, parang when we said that we have a healthcare provider and this is our coverage, tuloy-tuloy na talaga yung mga doctors to do what is needed. Pero yung mga wala, parang naaawa ka kasi they have to wait and then they have to call someone pa. I was waiting on the emergency room outside St. Luke's, no? And I was looking at the people around me. I can really see the difference between having a health insurance and not having a health insurance. Sabi ko, it's really fortunate that we got our health insurance, no? Having or getting a health insurance for yourself, hindi naman yun sa ini-aim mo or pino-foresee mo na ma-hospital ka. It's something that hospitalization or pagkakasakit is something we didn't know. Kailan siya dadating? Talagang dadating lang siya. No, it could come anytime, it could affect anyone. Sometimes sa hindi natin inaasahang pagkakataon. So yun yung mga ina-address ng ating mga health insurances na at the times like those, meron kang masasandalan for as long as you have them nung time na hindi mo sila kailangan. So I hope this video tutorial will open our minds a little bit about health insurance, especially if we are the breadwinner. So I really feel for those who are breadwinner because me myself is a breadwinner. So guys, kailangan din nating alagaan yung sarili natin. Kailangan nating protektahan yung sarili natin. So get your health insurance as early as possible. It depends on your budget. So try to set aside a budget for your health insurance. Pag maski maliit yan, dahan-dahan, and if you want, we can talk, we can chat, we can give you a quotation that suits your budget. Hindi naman kailangan kukunin mo yung what I have na 60,000. There are companies that has lower plans that will cover you also on your medical expenses whenever you need it. So I hope may natutunan po tayo sa ating video for tonight. So it's around 8 o'clock in the evening right now and I'm doing this video because I really feel na kailangan ko siyang i-share sa inyo para din doon sa mga nag-aatubili pang kumuha ng health insurance. Yes, I am a financial advisor myself, but I am not doing this video to encourage you to get it from me. You can get your health insurance anywhere. So from any company na comfortable ka, I just want you guys to get a health insurance for yourself because for me, it is really important. Thank you guys for watching and I hope you've learned something from it. And if you want to know more about health insurance, you can contact me or from our Facebook page, Simplified Finance. And also you can comment below and we can chat if you have a free quotation for yourself.